Now let's get to our big story at 5. The dangers of the virus continue, and not just for new cases, but after someone has recovered from COVID. Some people are dealing with the long-lasting effects, like on the lungs.
Team 12's Adriana Loya spoke to Valley doctors who say the difference between lungs from a vaccinated person versus an unvaccinated person with COVID is dramatic.
It's been 10 months since Chris Paddock battled COVID-19.
Anything to do with breathing, energy levels, it dropped.
Chris was hospitalized for a week, but the effects the virus had on his body still persist.
I can only go running for about 30 minutes, and then I start to get a little dizzy, and that's something that's been going on for about 2 months now.
Shortness of breath and weakness are constant reminders of the illness he says could have been less severe if the COVID-19 vaccine would have been available back in December when he was infected.
If I had access to that, got it, and then contracted COVID, I know it wouldn't have been as severe.
The only people that are really getting sick are people that are unvaccinated.
Dr. Sam Durrani is the chief of staff at Deer Valley Medical Center. He says he can tell if a patient is vaccinated or not by just looking at their x-rays. The image on the left is from someone who is vaccinated. The black area is air flowing, which means there's little to no damage to the lungs. The image on the right is that of an unvaccinated person. The lungs are congested and limiting oxygen throughout the body.
But if you have a vaccinated patient that comes to the ER with a breakthrough infection that maybe has some shortness of breath, and we do a CT scan, they are not nearly as bad as the unvaccinated COVID patients. Even the breakthrough infections that end up getting pneumonia, their CT scans still were not as bad as the scans of unvaccinated patients.
New CDC data shows the risk of dying from COVID-19 is 11 times higher for unvaccinated adults than those with the shot.
The vaccine is working extremely well, and it's keeping the virus from progressing to pneumonia or infiltrating the lungs.
As for Chris, he's fully vaccinated now. And after losing loved ones during the pandemic, he's urging others to get theirs too.
It's important for people to get the vaccine shot, the first, second, and third, all of them.
Adriana Loya, 12 News.
Adriana, thank you.